have to ask you about this heat wave. We're now hearing that there could be possibly dozens of deaths that are attributed or factor in the heat wave as part of the death. And we also know in British Columbia, there are a lot of places that don't have air conditioning, whether these are seniors' homes that we've heard from hospices saying that they are struggling. We know people have mobility issues and may not be able to get to a cooling center. Some may not have heard about cooling centers. So I'm wondering if there's more that the province could have done to help the people of British Columbia during this time. Should there have been a provincial coordinated response like we see for wildfires or flooding?
Well, that's a very good question. And we have, of course, the coroner will be issuing a report later in the day about unexpected deaths over the past, I believe, 48 hours. She will be, as she always does, investigating those fatalities and reporting out to the public directly. My concern going into the weekend, seeing the forecasts of the record-breaking heat in British Columbia in places that have not experienced that. Here in Victoria, for example, you're on an island in the Pacific Ocean. You don't expect to be hovering around 40 degrees. Port Alberni, Kamloops, Lytton, of course, setting a record. We have tried, and our cities, usually those that are accustomed to heat like this, have municipal programs in place to protect people, calling on them to come to cooling centers, ensuring that we're checking up on the people we care about and the people that we know may well be in distress. Obviously, we can always, in hindsight, have planned to do better and do more. In this instance, I think the big lesson coming out of the past number of days is that the climate crisis is not a fiction. It is absolutely real. And if you look, I've had a briefing from the Wildfire Service yesterday and again today. The entire west coast of North America, from Baja to Alaska, is red hot and awaiting what could be another catastrophic fire season just ahead of us as lightning starts to come into the equation. So are we in a difficult patch as a province and as a region? Absolutely. But these are longer term challenges, and that's why our Clean BC plan and ensuring that Canada continues to demonstrate leadership internationally. This is not a British Columbia problem. It's not a Canada problem. It is a global challenge, and we all need to have citizens of the world coming together, as we have, quite frankly, to address a global pandemic. We now have to redouble our efforts to address global warming and the consequences on people, on communities, and on the landscape. And most importantly, I think, on the landscape, as we've seen, should we end up having another difficult fire season, that will be 3 out of 4 of the seasons that I've been Premier have been record-breaking. And no one can plan for 3 out of 4 years being the worst ever. With respect to how we keep people safe, there are a range of issues. Keep the blinds closed. Have that cold cloth in the fridge to make sure that you're cooling yourself down. Hydrate. Dr. Henry and Minister Dixon and I were talking before we came down about the steps that people need to take. We are hopeful that those hints are getting out to people. Those directives are getting out to people. We could have done a better job, but I think there's a saturation point with many people. We have been talking about COVID-19. We've been talking about opioids. We've been talking about climate. When the heat hits, the public goes to the coolest place they can. And what we need to do is remind each other that we are in a community. And if we are feeling well and able, we should check on those that may not be.
Going back to the phone lines, Lisa Houston, News 1130.
Premier, just to follow up on that a bit. No, we didn't know, we haven't experienced this kind of heat before, but I'm talking to scientists who say that their forecasting was accurate, and as of last Wednesday knew that this kind of outrageous heat was coming. And, like people from warm climates and cold places, they don't quite get how dangerous it can be. And so why did the province not do more to ensure that the message was getting out? The scientists I talked about in France how this has happened, and they saw hundreds of people die. Why the message wasn't given by the province better to say this, you've made it through COVID, but this could take your life? Because I don't think enough people got it. We're seeing that with the number of deaths.
Well, again, I'll await the coroner's determination. As Dr. Henry said, fatalities are part of life, and the consequences or the causes of those fatalities are examined by officials that we put in place as a society to make sure we're getting the best information possible so that we can put in place programs and policies to protect people going forward. And again, this was an unprecedented heat wave, records broken day after day. The public was acutely aware that we had a heat problem, and we were doing our best to break through all of the other noise to encourage people to take steps to protect themselves. But it was apparent to anyone who walked outdoors that we were in an unprecedented heat wave. And again, there's a level of personal responsibility. I'm not ducking the issue at all, Lisa. This is a tragedy upon a host of others that we've had to address over the number of months. But I believe we did what we could to get information out, and we rely also on the public press and media outlets who've done a really good job, in my mind, of making the case. Weather forecasters on all of the networks on radio were making the case, telling people to be wary, and we have our presence, our internet presence, and social media doing that as well. So I'm not dodging the issue, but again, you can prepare for a whole bunch of things, but if you don't have air conditioning, which certainly I don't in my home, you can't do much about it other than find other alternatives. And I will also say, though, that one of the advantages of COVID is that allowed us to make significant investments in air conditioning and HVAC systems within our public school system. Minister Dix is recreating our long-term care capacity across the province, which will involve new facilities, upgrading existing facilities. These are longer-term projects, but made more important now than ever before because of COVID and because we now are absolutely clear that climate change is affecting us in ways that we hadn't yet imagined. This is, as I say, another horrific year of heat that we're not accustomed to in a temperate rainforest.
Follow up, Lisa?
Yes, and this one may be for Dr. Henry. With all the changes that are coming regarding lifting restrictions from the pandemic, how quickly can changes be made again if we have to, I hate the word pivot, but pivot like the UK and Israel has had to do? And do you expect that may happen anytime this summer, or is it most likely to happen when, cold and flu season starts again in the fall?
I want to start by just adding one other thing to what the last question you asked the Premier, in that from the health perspective, we have had a heat health alert plan in the province, particularly in those areas where we tend to see heat waves come periodically, so the lower mainland and some parts of the interior. But they are relevant, and we monitor these impacts across the province, and all of the health authorities implemented heat alerts and worked with their local municipalities on Friday to make sure that we had cooling centres open and that we were putting the message out to people about the things they needed to take, the measures we needed to take to keep safe. There's a lot of information on the BC CDC website that's been put out with Dr. Sarah Henderson and Tom Kozatsky and our team at BC CDC. And I know my colleagues across the province in public health have been working with municipalities to make sure that we have places where people can go and systems to check in on people who are at risk from heat. So those are some of the things that we started on Friday when I was up in Kelowna working with the team there.
There's been a lot of criticism about how BC Emergency Health Services has handled the heat over the last few days. Will anybody be held responsible here for what happened? We're going to get this coroner's report. Will somebody be held responsible for deaths that we've seen linked to the heat? And does there need to be an extension of a state of emergency in some semblances to manage the heat as it sort of cools in the lower mainland but will continue in many other parts of the province?
First of all, each health authority has their emergency plan related to the heat and has had that in place since Friday actively. We have emergencies operations centers for it because there is an expectation of challenges. And it's not just BC Emergency Health Services, it's our home support networks, because by definition, people who receive public home support have underlying health vulnerabilities. It's long-term care, it's acute care. And you've seen this in operation. One of the public ways it was done, of course, was the shifting of staff and the decision to cancel some immunization clinics on the weekend. So we saw some of that. We received in the last 24 hours yesterday a record number of ambulance calls. On Saturday, that broke the record on Saturday, and on Friday, 1,950. And I think that our ambulance paramedics have responded to that, as they always do, with extraordinary effort and bravery under the circumstances. It is a very challenging time. It's why Minister Mike Farnworth put out the information that he did to the general public, and it's why we've been responding. Just to give you an example, 2,200 emergency rooms visits in the Fraser Health Authority, when we typically get 1,600, has meant a plan to reallocate staff to support emergency rooms, including allowing ambulance paramedics to leave more quickly because they're getting off to other calls and not be stuck in emergency rooms. So in every part of our healthcare system, emergency rooms, acute care services, long-term care, of course, home support, and in the community, there's a response. And then there is the reality of this heat day after day, which affects us as human beings profoundly, especially those of us with underlying health conditions. And we have to do everything we can to support each other in these times, even over the next few days when, as you say, the heat in some communities may lessen, not in all, but where we have the cumulative effect of day after day of this. So that means that we have to support one another. Sometimes that means not just phoning, but visiting. All of the steps Dr. Henry has spoken about, all the information that's been put out publicly. But I think with respect to our healthcare system, and what we have to do with BC Emergency Health Services is to continue. And I believe on July 2nd, we're posting yet more hundreds of new positions, new full-time positions in BC Emergency Health Services. We've had record increases in recent years. And the reason why is we need to transform our ambulance system into what the demands of the 21st century, because it was very much in structure prior to that, based on a model that no longer was relevant. And I think we've been doing that. But every ambulance system is going to be tested by this kind of record day. It is profound and challenging. It's why calls are triaged, and it puts pressure on our dispatchers, it puts pressure on our ambulance paramedics. And I think, as I say, they respond to it. And it's being done, of course, in the context of the COVID-19 public health emergency over the last few days and the overdose public health emergency, which has particularly affected those systems. So we have to continue to do what we've been doing, which is adding hundreds of full-time ambulance paramedics positions, but also providing other supports in communities so that our public healthcare system can do a better job supporting people in these times. And I have to say that I know people are working flat out, and it feels like working flat out after a year and a half of working flat out after, in the case of the overdose public health emergency, 5 years of working flat out. So this is the challenge we face. I think I said, we talked about it yesterday, but we also talked about it in early June, that this period with the reduction in COVID cases and COVID transmission is going to be a real challenge for our healthcare system, because our system has been stressed over time by what has been, in our lifetimes anyway, an unprecedented pandemic that's affected every one of our communities. And now, of course, there are all the other things that happen on a daily basis that challenge us. But I think our ambulance paramedics are, as always, responding to it well, and we have to continue to support them by adding resources again and again and again, and that's what we intend to do.